You are now listening to Nailed It, the Orthopedic Surgery Podcast.
Now, what about for our muscle tumors, which I hear one of them isn't as controversial for chemotherapy versus the others?
Correct. So leiomyosarcomas, sort of extrauterine leiomyosarcomas, right? We all learned in medical school about uterine leiomyosarcomas, but we can see them within the extremities, are treated like all of the other soft tissue sarcomas. But characteristically, what you see here are cells with what we describe as cigar-shaped nuclei. So these elongated but rounded, sort of rounded nuclei. And again, they get treated with surgery and radiation, and then, sort of more controversially, plus or minus chemotherapy. Rhabdomyosarcomas are probably kind of a category onto their own. They are sarcomas, and they're the most common pediatric soft tissue sarcoma, but they have their own very particular staging system, and treatment is dependent on size and resectability and a number of things that we don't take into consideration for many other soft tissue sarcomas. That being said, these tend to be very chemosensitive, so chemotherapy is usually always part of the treatment regimen for these patients, in addition to surgery and radiation. And then again, because translocations are easily testable, there's a 213 translocation with the PAX FKHR gene rearrangement. So a good one to put on your last minute cramming list.
Yes. So just to reiterate, our myxoid liposarcoma was 1216. Rhabdomyosarcoma is 213 for our AX-FKHR gene. And how do you tell the difference between, I still have trouble with this, the difference between leiomyosarcoma and rhabdomyosarcoma on histology?
Yep. So again, we talked about leiomyosarcomas having those cigar-shaped, sort of cigar-shaped nuclei, so elongated and rounded, whereas rhabdomyosarcomas have really small, sort of rounded cells with not a lot of cytoplasm in a lot of situations. Sometimes they will start to organize in some patterns where there's kind of an eosinophilic matrix between them. There are some descriptions of them being called sort of racket-shaped cells, although that's a description that's never sort of clicked in my brain. But they look like they almost tend to look like a small round blue cell tumor, but with some matrix around them.
Okay. Yeah, that makes sense.